Welcome back. Richard, we are midway through the first month of the new year.
And I'm laughing because one of the things I need to do today is take down my Christmas tree. And I only say that because, it just seems
January,
like
we should take it down.
Here we are. It's already the middle of January. We're actually past the midpoint of January, and it's just unbelievable that everything is just sort of tumbling by.
Right. It's going by very quickly.
It is. Yeah.
And it doesn't help that it seems like each week there's some new big event, big incident, something that's going on that's taking everybody's attention and giving us something new to focus on.
Right. But my daughter lives in Washington D.C. and she said the military is really there's vehicles and soldiers, and the place has been locked down. She had a hard time getting to her office. She had to have all kinds of documentation just to get to her office because it's 2 blocks from the Capitol, and
wow.
They won't let you anywhere near the Capitol.
Yeah,
unless you have to have some kind of special pass or some kind of special credentials to get into the perimeter. It's really locked down. So sad. But you're right. So much is going on, and you try to stay up with it, and all of a sudden the days and the weeks are just flying by.
They are, and it, of course, COVID continues to be a major topic. It continues to be a major theme into this new year. For some good reasons and for some challenging reasons. Good reasons, of course, is we have the vaccines are being delivered. There's some, of course, discussion about how quickly they're becoming available, how broadly they're becoming available, but they're becoming available nonetheless. And but on the other side, we are losing just over about 4,000 people a day.
We a couple of weeks ago, when we were losing 3,000 per day, we were saying it's the equivalent of 8 passenger jets crashing every day. And now we're up to a little over 4,000 a day are dying. And so there's this odd conjunction of factors where, on the one hand, everybody's becoming more optimistic, but on the other hand, the numbers keep getting worse around the world. They're getting worse around the world. And so, you're right, though. There is so we call it a conditional optimism.
Right.
It's the vaccine promises to slow or maybe even stop the pandemic, although there was a report out on Friday that, and we've said this many times, this virus will always be with us.
Right.
It will, like all viruses are, they're always around, they're ubiquitous. So this will always be with us. But with the vaccine, we can slow it down or maybe even stop it, at least as we have with other viruses. The other optimistic thing about the vaccine is that if you're vaccinated and you get the virus, your symptoms are probably going to be much milder. And that's good news as well, because that reduces hospital visits and the morbidity and mortality that comes with the disease. So the vaccine offers us some hope, but we have to condition that hope with some other issues that are beginning to emerge.
Absolutely. And, I think that the article that we found to discuss today really hits on an important point, a point that we've, sort of alluded to a few times on the podcast as we've talked about, sort of the consequences associated with quarantining and being in isolation and some of the social distancing and things that we're having to live with right now. But it really started to bring it to home as it relates to COVID itself, just the broader effects of COVID and the, from economics to sort of interpersonal, how that is affecting our mental health.
Right. Yeah, because we know now, we've learned about this disease. There's a funny phrase we used to use, you build it while you're flying it.
Right.
And that certainly is the case with this. We have learned so much over the past year. Now it's been almost a year we've been dealing with. So we learn, and now what we're learning is there are some long-term, for many people, there are long-term effects of
Right.
it. You don't just when you get a cold and you get over it and then you're symptom-free and you're free. But this virus may linger in some people.
Right.
And it's another one of those confusing aspects of the disease, why some people seem to have a mild case and get over it with no after effects, and other people get it and they seem to suffer long-term sequelae and symptoms persist for weeks or months, and we don't know how long they'll persist because we've only been doing this for a year.
Right. And some of the long-term effects that the CDC have talked about are physical things, from fatigue and shortness of breath and chest pain and lots of effects on the body itself.
Right.
As it relates.
You and I know a person who had the virus early on, I think in the spring. She got the virus, and she says she still feels shortness of breath and some chest pain and that was, my goodness, probably 7 months ago or longer.
Yeah.
And she's still having she said she notices some things. I know some other people have had it more recently. They were free of the virus, but 3 weeks later, they said they're still exhausted. All they want to do is sleep. And so there are the possibility of lingering effects. Some are physical, fatigue and shortness of breath. But it can also include some psychological effects, some long-term psychological effects. So in this article, they mention the various effects that the disorder may have, the various physical effects. What we want to talk about is psychological long-term effects. And once again, we're reminded that there's no safe experience with this disease. It's almost a gamble that you're taking. Some people say, well, I had it and I'm fine. And other people are not fine. Some people are dying. Some people, it takes a long time to recover, and other people seem to be struggling months later with the after effects of the disease. So again, we stress the best policy is prevention.
Yeah, and I think it's important to really, again, emphasize that it's the way that any individual responds to it is unpredictable.
Right.
You can have there. We know of people, and there's been plenty of reports where a couple who live together will get it. They'll both have it, and one of them will have very mild symptoms and recover very quickly, while the other one is nearly, if not hospitalized, nearly hospitalized. It doesn't matter. We know people, or we've seen reports of people who are athletes, very physically fit, and they suffer, serious consequences and serious symptoms of it. So it doesn't. It is certainly equal opportunity when it comes to some of those consequences, because we just can't anticipate how any particular person is going to respond to that virus.
That's right. And people continue to be a little bit cavalier about this virus. You talk to many people and they say, oh, it's no big deal. Or I know people have had it and they're fine. But it is a roll of the dice. And you're not going to know until if you get the disease, what the short-term, intermediate-term, and long-term effects might be on your body. You might survive, but you might survive with long-term physical and psychological consequences. Most of the people I talk to have some mild depression afterwards, but I think that's related to the fatigue. And most of all, they talk about chronic fatigue. And there is a possibility that many people could end up with chronic fatigue syndrome. That Guillain-Barré is another one that is associated with these kinds of viruses. That's more temporary. But chronic fatigue syndrome, as the name implies, is could be a chronic condition. So again, we like everybody else who studies this disease and is serious about it, urge you to prevent if you possibly can. How do you prevent? Our good friends: masks, washing your hands, avoiding crowds, and stay outside. Don't be caught in
Right.
small spaces, homes and restaurants. So again, everybody's urged to prevent if you can.
Right. And so as the title of the article that we're going to be pulling information from today suggests, the main issue, because we have the vaccine that's going to help with, hopefully, with the physical symptoms and the acquisition, I guess, the becoming infected by the virus, it's going to help with all of those things.
Right.
The topic today is that mental health is going to be the biggest pandemic issue that we face this year,
Right.
because we are all going to be, even if we're all physically well, we're still going to be dealing with the psychological and emotional consequences of the past year, and all that's happened over the past year, from losing loved ones, to losing employment, to the financial loss in general. I talk to a lot of students, and a lot of students are really distressed right now, especially students who are just starting in college, or just are graduating high school or graduating college. They're feeling as though all that they had been looking forward to for the past 12, 13, 14 years, all of that is gone, because they're not able to enjoy life at on college campuses and stuff, because everything is virtual. So it's affecting everybody in different ways. And again, the topic today is really going to be focusing on that mental health aspect.
Right, because 2020 was just, everybody laughs about 2020. When we got to the end of the year, we're saying, aren't we glad this is over? 2020 was a tumultuous, confusing, there are no adjectives left to describe what 2020 was like. And the disease sort of took over everything. It just overwhelmed country after country. And so we were caught in this almost state of confusion in 2020. 2021, we're probably going to get this disease under control with the vaccines. However, there are going to be long-term effects. It has taken this disease and all the battles, the fights we've had, the political and social, financial battles that we've had, have taken a toll on everybody. And it's going to continue to take a toll into 2021. A lot of these things are going to be delayed effects. People, and we'll talk about this as we go along, but people who have a pre-existing mental health condition could be much worse in 2021. So there are a number of issues that will emerge in this year that we're going to have to deal with. And most of those, especially if we get the physical aspects of the disease under control, most of those are going to be psychological and psychiatric.
Absolutely. And so in this article, the author, she reviews or discusses a couple of really specific areas that we're going to be facing, issues in some of these areas that we're going to be facing over the course of the next year.
Right.
And it is important to think about these. And, while we're going to be facing these things, it's important that we talk about it, so we can plan and anticipate, and hopefully, vaccinate ourselves from a psychological perspective.
Right. Yeah.
These things, if we're anticipating them, we can do something to help prevent them from happening.
Right. That's a good point that you make. You have to immunize yourself against the psychological effects, just as you have to immunize yourself against the physical effects.
Yeah. Absolutely. So the first area that she talks about is that we're going to be facing in the next year is the issue of burnout and sedentism.
Sedentism. Did you ever see that word before?
It just seems like not in that form. Of course, it seems like it's derived from sedentary.
Sedentary, right. I had not seen the word sedentism before.
Yeah.
Oh,
You have
yeah.
to look at it closely to see what it
Right.
is. But yes,
But sedentism is living in one place for a long time. There are people who stay within a mile or two of their birthplace. You know,
right,
they live very close to where they were born, and they spend their entire lives there. Um, um, and there's a word for that. It's called sedentism.
right.
Okay, and certainly we've experienced that.
Right, but the issue here is that the issue that the pandemic has introduced is that while there are those who do that and they do that willfully and intentionally, there are others who do move frequently. They maybe they own homes. They're we call them down here snowbirds. Folks that live up north during the summer months and then they come down here during the winter months.
Mhm.
That maybe weren't able to do that because
Right.
of uh, fear
Sure.
of becoming ill
Mhm.
or being exposed to the virus, and so now they're stuck in those homes that they otherwise would have moved from for periods of time over the course of the year, and there's consequences to that.
Mhm.
If you have your typical normal routines, that includes moving from one place to another, and you're not able to do that, you're going to have some consequences to that psychologically.
Right. Yeah. So this inability, the being stuck in one place has been. Bernie, imagine if you were. Happened to my sister. Um, if you weren't working every day, if you didn't leave your apartment to work, you told me one time that there will be days that will go by where you don't speak to another person. You don't have oral language for 2 or 3 days.
Right.
Okay.
Last summer, when everybody was staying quarantined and
Mhm.
everybody was and school was out, and we now I would have patients some days, virtual patients some days, um, but there were days when, like weekends or something, when there were no patients. Yeah, I would go days without talking to anyone.
Right, right. You told
And,
me that one time, and I thought, wow, that's right. You wouldn't. Because there was no reason to. You know, schools weren't in session. There was not, and I was struck by that. That was one of my favorite COVID stories. Is Bernie hasn't talked to people he hasn't used oral language for 3 days or four
right,
days. Yeah, yeah. It was a weird finding.
right,
But so the first thing all of us are struggling with is burnout and sedentism.
right.
Burnout we've called it COVID fatigue, or um, you know, um, and so we're all just tired of it. This homeschooling has been very, very difficult for everybody, for parents, for kids, for teachers. Trying to stay safe. My son and I went to the grocery store, got in there, and realized we didn't have our masks, and so we had to go to the counter and they gave us masks. The financial hardships
Right.
for many people, teleworking, the adjustments that we've all had to make with that, keeping up with new information, hoping that you have the latest information.
Right.
Now the latest information is, when can I get my vaccine?
Right.
And there's all that confusion. Every day there's this tumult, this is stuff that you're trying to keep up with. And then coping with sickness and death. And she refers to it as whack-a-mole, that arcade game. This stuff keeps popping up. And that leads to burnout.
Yeah.
Sedentism is being in the same place all the time. And you really have to feel for parents. My son is going through this. Parents who are home with their children day after day after day after day and can't go out as they used to. It's, you can't take them to parks and to places. And so people are stuck in place. So burnout and sedentism are two things that we're going to have to deal with. We are dealing with them now. We're going to be dealing with them throughout 2021.
Right. Right. Because there's still going to be some isolation. There's still going to be some, loneliness
Mhm.
um, that accompanies over the course of this next year. And so,
Right. Some people have really, really struggled
absolutely.
with these issues. Many of us are fortunate because we're able to get out, we're able to stay active, but there are a lot of people out there who have really struggled with these burnout and sedentism.
Right. The second issue that she mentions is the the big issue of sleep.
Right.
That the nature of the pandemic, and it makes sense from a psychological perspective, that the anxieties and the worries and the fears could interrupt and interfere with sleep.
Yeah.
Initial insomnia is really a significant issue when anxiety is at play. You lay there and you just ruminate over what's happening or what's going to happen, or different fears. But then you also have the issue of sleep, because when you stay inside all day, you start to lose a sense of time. You wake up and then you start doing something, and if you never go outside, or the windows are closed and those kinds of things, you don't have the sun or anything else as a reference for what time of day it is, and suddenly it's night and it's time to go to bed again, and you haven't done anything to be ready to go to bed.
All right. Yeah, the obvious thing is, the stress of all this is going to interfere with sleep. But the other things that we don't typically think about are things like, when you're home all day, you tend to nap.
Right.
When you're at work, you're obviously not going to nap most of us. Some of us nap at work. Most of us don't nap at work. But when you're home, you don't have that clear distinction between work and home. And the lack of separation between work and home messes with your circadian rhythms.
Right.
I have lots of students, and their parents will tell us that they don't have that clear separation between home and school. And so they're blending the two,
right.
And your day stretches out into 24 hours. Instead of 7-hour segments where you're in school for 7 hours, you're home for 7 hours, you sleep for 7 hours. Now you're home for 24 hours, and it has disrupted your circadian rhythms, right? The other thing is pandemic dreams, and I've heard people talk about these.
Yeah.
People are dreaming in odd and mysterious ways, because dreams are your brain's way of working things out and storing things in memory. And so people are having odd kinds of dreams during the pandemic. And the last thing is weight gain.
Right.
We chuckle sometimes about the COVID-15, but for some people, it becomes a health issue, because being overweight increases the chances that you're going to have sleep apnea, and that's a more serious physical problem.
Well, not just that, and one of the reasons why there is weight is because it's sort of a a dual relationship, because weight of being having weight related issues affects your sleep, but having sleep problems affects how much you eat.
Right.
If you're awake for longer periods of the day, you have to eat more, because if you think about 3 primary meals for every 16 hours that you're awake, if you're awake for 20 hours at a time, now that's an extra meal.
Exactly.
And so it keeps you up and you eat more.
Right.
So yeah.
So sleep is, we talk about sleep all the time. Everybody's, everything you read, you have to sleep better, but people are, if you're drinking more, you're not sleeping well. And we know people are drinking more.
Right.
Substance abuse has gone up. If you're using drugs and alcohol, you're not sleeping as well. You're staying up, TVs are on, you're trying to keep up with the news. So all the things that you shouldn't do are things that we are doing right now. And we're caught, you're right, you're caught in this vicious cycle. And what it's doing is it's messing your sleep. My sleep is a complete catastrophe right now, and I know that, but I'll have to work to get it under control.
Right, absolutely. And that leads us into the third one, which is the idea that some mental health conditions, some disorders, really thrive on isolation and the loneliness that we're experiencing.
That's right. I think this is really an excellent point, and one that I hadn't thought about. But there are disorders that thrive in isolation.
Right.
And the most obvious, of course, is substance abuse.
Right. Yeah. When there's no accountability, you sit in an environment where that's what you do.
Right.
And so alcohol abuse, substance abuse in general, really thrives off of that isolation.
Right. You know what the model that Weight Watchers used for years was you had to do these public weigh-ins,
Right.
or you go to NA meetings or AA meetings. It's being out there publicly,
Hmm.
claiming, and owning that, and it's that accountability that's missing right now. You know, when you have to go to work every day and you put your clothes on and they start to feel a little bit tight,
Hmm.
that's a reminder that, okay, you got to cut back a little bit. But if you're home every day in your pajamas and you have an elastic band around the pajamas and you don't care what you look like, days are going to go by and you're going to be gaining weight that you don't know you're gaining. You
Right.
know, and so yeah, without support and accountability, eating disorders and substance abuse, they thrive. Okay. Plus,
Right.
you have the collective trauma, that we're all experiencing, and that creates isolation. And we now know that relapses of drug and alcohol abuse are increasing. And in fact, opioid abuse, which had been going down, is now spiking again. Okay.
Right.
And there are lots of opioid related deaths are beginning to increase. Um,
Absolutely.
and
Well,
so,
and in addition to substance abuse and eating disorders, you have the whole idea that, anxiety and depression thrive off of isolation. I mean, one of the main symptoms of depression is withdrawal from other people in other situations,
yeah,
and a tendency to isolate oneself.
right.
Anxiety, the same thing. You're avoiding some of those situations that create anxiety. So, yeah, both of those also really um, strengthen some of the symptoms associated with anxiety and depression.
And that's why we're always reminded and encouraged to get out as much as you can. Now, we are fortunate in that we live in a climate where we can go out every day. It might be chilly, but you
Right.
can still go out. People who are in northern climates, this is the winter, and it's much more difficult to get out when you live in those climates. It's dark early, it's cold rains, it's snow, and you're battling the elements to get out too. It's like what Mark Kelly said, Mark Kelly said about being in space.
Right.
You can't simply walk outside when you're in the International Space Station. So you have to manage it differently.
Right, absolutely. And that's another important point that was brought out in the article, and that is that these issues affect us differentially based upon all kinds of different factors.
Right.
As you've mentioned a few times, rightfully so, the idea that, for those of us who are able to get out of the house to go to work, um, isolate, we're not as isolated as those who are having to work from home.
Right.
And so those who have to work from home, that sense of isolation and solitude increases. I know of someone who, not only is she working from home, but she has two kids that are homeschooling.
Right. Right.
And so, and she's by herself.
Mhm.
So not only is there that isolation, but she's only with her kids, and she is, so she's managing them 24 hours a day. She's working as much as she can and has to, and
Right. Mhm.
she doesn't get a respite.
Right, right. No, and that's the whole issue. That one of the things that's going to be an issue is that we're not experiencing this pandemic equally.
Hmm.
We don't share equally in the pandemic.
Right.
There are a number of news stories that come out that, and I'm sure most people have seen them, that people who are very wealthy, Jeff Bezos and some others, they've added billions of dollars to their net worth during the pandemic. I mean, Jeff Bezos through Amazon has really flourished, and other companies like that have really flourished during the pandemic. While other places, restaurants in particular, brick and mortar stores, shopping malls, other places are closing their doors. They're shuttering their doors, and so we're not experiencing this equally. You mentioned the story about the parent with the two children,
Mhm.
and I know a case where there's the one parent has to stay home because the children are preschoolers; they're not able to go to school yet, and they live in a fairly well-to-do area, and they're watching their neighbors who are able to work from home or go to work, either one, they're doing just fine. And they'll say, hey, do you guys want to do this or do that? Well, this couple can't because they're down to one income instead of two incomes.
Right.
So they just can't do it. And it's creating a little bit of animosity in the neighborhood because they're not sharing this thing. They're not experiencing this thing equally.
Right. Well, and the more animosity from one family who's taking it seriously and
Right.
isolating and doing all that kind of stuff, and then their neighbors not. And it's even, it's really exacerbated when you have kids and the neighbor who's not taking all of this very seriously also has kids, and those kids are outside running around and having a good time and playing, and that you don't want to send your kids out there because you're worried about exposure, and so then you have all of that to deal with your kids, and so there's a lot of issues at play here.
Right. Yeah. And then there's all the people who don't have a choice. You have people who cannot work, from bus drivers, janitors, people who have to be places to work. They have to go whether there's risks or not. You have all of the healthcare workers who are walking into hospitals where this stuff is ubiquitous. I mean, imagine that you had to do that every day. And so you have all those people who don't have a choice to work from home. How does it make them feel? And then you have people who've lost their jobs.
Right.
But it's not just the loss of income. You also lose your health benefits at a time when you might need health. You're at increased risk for needing your health benefits.
Right.
And now you've lost them because they're tied to your job.
Right.
Okay? The other thing that I didn't realize is we've heard many stories about how the disease is differentially affecting Native Americans and people of color. But another issue that came up was racism against Asians. There's this thing about the China virus and all that stuff. And so there have been increased incidents of racial hatred aimed at Asians.
Right. And then there's again, thinking about the way in which this condition, the pandemic is affecting us differentially. You have those people who were already a bit anxious, those who maybe had OCD related to germs, and they're very anxious about cleanliness and things like that. This pandemic has made those symptoms explode. I mean, they're just they can't control themselves. And I have people that I'm working with who their hands are cracking because they're washing their hands so much. And it gets to there's that tipping point where you want to wash your hands enough to stay safe and clean and protected, but you can't do it so much that you damage your hands, and then they become vulnerable for other reasons.
Right. Yep. And we know people, we know many people who have obsessive-compulsive disorder. Well, that got much worse especially if you're a germaphobe,
right,
worried about germs before the pandemic.
Right.
Imagine what it does to you. And we've had cases where people have really had some serious, almost psychotic episodes because they became so worried about the virus that they actually got sick.
Right.
Yeah.
Right.
The other thing, one more that I hadn't thought about,
Right.
in the LGBTQ community, you might be spending a lot more time with people who don't accept you.
Right.
If you're going to school every day, you're out, or you're a college student and you're gay, but you're on campus, you're not in your house. Well, now that if campus is closed and you have to return home and your parents don't accept you, that can create considerable strain on a person.
Absolutely.
And this phrase, inequality kills, statement was made by Lisa Carlson. And Lisa Carlson is the past president of the American Public Health Association. She teaches at the Emory University School of Medicine.
Right.
And much of this article that we're talking about is based on her work at Emory about the mental health pandemic. She's a physician there at Emory. And so much of this is taken from her. And there's a quote at the end that we'll attribute to her as well. So this information is it's really going to be a serious problem. She talks about inequality kills. There's going to be a lot of anger. There's going to be a lot of animosity. I don't think it's going to lead to riots or that, but I think there's going to be a lot of ill will,
Right.
animosity, anger that we're going to have to deal with. The people are going to have to struggle with as we see this pandemic wind down.
Right. And that leads to that issue of, people who are no longer, infected, or people who were never even infected by the virus,
Right.
but are sick.
Mhm.
Nonetheless, sick from the psychological effects. There is that phenomenon of the long haulers who, were infected with the virus, and seem to have recovered from the virus, but continue to have lingering physical symptoms for a long period of time.
Yeah.
But then, again, there's others with the psychological effects that continue, and maybe even worsen over time, as a result of the pandemic.
Right. Yeah, there's a difference. There's being infected and being sick.
Right.
So the illness can last much longer than the infection,
Right.
as it has in many cases. People they get their test is negative, but they remain with symptoms
Right.
long after the disease is gone.
Right. Absolutely.
So is there a silver lining in all of this?
Maybe. I think it depends on how you want to, on how you think about it and how you approach it, because clearly this is a time in which most of us can see that we're experiencing consequences of the pandemic that we can't fully control, whether it's anxiety, depression, stress, whatever words we want to use to describe it. We're all experiencing those things, and it becomes increasingly difficult to manage. And so it's increased that awareness of, maybe I need to get some help. Maybe I need to get some support. And so hopefully, one of the things that the pandemic and this whole, situation can do is sort of decrease that stigma about getting mental health support, mental health therapy, so that people in need will be more willing to go out and get the help that they need. And they will be, less reluctant to seek that support, because we all need it.
Right. There's this phrase going around, but I really need to see somebody, or I really need to see I really need to see a shrink, is how a lot of people, I'm really struggling. So the stigma of seeking mental health assistance may be diminishing because people are realizing, oh, this is not as bad as I thought, or this is what I understood it to be, and it's really been a big help for me to be able to talk to somebody else about it. I've had many patients come in and say, "No, I'm okay. I just feel good to be able to talk about this every week and kind of unload it, not on a family member, not on a spouse, not on my kids.
Mm.
It gives me a way to air this out in a sort of a neutral setting."
And teletherapy really helps with that, because one of part of the you know part of the stigma for many people is having to go to a mental health therapist's office.
Right.
So being able to log in from wherever you are, and talk in, you don't even have to leave your home, is certainly a benefit, for that has come out of the pandemic. And
Right. Yeah, it
the
really
approval
has
of,
made a huge difference. We were all concerned about teletherapy when we first were shocked into having to use it. And we thought, oh my gosh, how is this going to work? Many patients really appreciate it. People with physical disabilities,
right.
ambulatory problems, people who don't drive. I mean, I have many people who don't drive for one reason or another. And this has been a fabulous boom. This has been a wonderful change for them. You have other people who have to take time off work.
Right.
Now they can see us during their lunch hour or some other time of the day. And so, no, the teletherapy, I hope, is here to stay. I think it's going to be especially important for many people. So,
Absolutely.
yeah,
So,
that may be one of the benefits coming out of this.
yeah, the benefits from the pandemic, hopefully, is that, we have a decrease in the stigma, but that that increased willingness to support and help each other, and to be there for each other, and to understand that we're all going through this together, no matter who you are, no matter where you live. this pandemic affects everyone. So we need to be there for each other.
Right, right. That's right. And that was one of the, the most glaring example of animosity is with masks.
Right.
How angry you get when you see people who belligerent, so I don't have to work. No, you don't have to, but it would be nice if we all shared this experience equally, and that's an area where we can, we can't with work and we can't with school. But one of the areas where we can be considered is, hey, it's not a problem. I can wear a mask. It's not a big deal. So.
Yeah.
Yeah, we're in this together.
That's right.
How many times have you said that in the column and here, that we can do this, but we have to do it together.
Right. Yeah, we can't do this alone.
Right.
Nor should we. I mean, again, we've already talked about the consequences of that isolation and loneliness. So let's do it together so that in the very least we battle that
Right.
that issue.
Right.
But that final quote that you mentioned from Carlson is a great quote.
Right.
And certainly is a a push for mental health awareness for everyone.
Yeah, we really see it with this pandemic, the relationship between physical health and mental health. I mean, I think that if one of the things that I've become acutely aware of is that people are beginning to realize that there is a relationship.
Right.
You can't separate physical health and mental health. They come together.
Right.
And we realize that now that yes, we're struggling physically, but goodness, we are all struggling emotionally.
Right.
That's what these sort of things do to us. And so I think it's given the entire country, our whole culture, a new, fresh look and appreciation for mental health. Maybe finally we'll move toward parity. We've been talking about parity for 25 years.
Right.
And maybe we'll move toward parity.
Absolutely. And so the quote from her is, every time we talk about public health, we should talk about mental health. And every time we talk about COVID-19, we should talk about mental health.
Right.
And again, it's a good reminder that, everything that we are experiencing, whether it's COVID-19 or it's public health in general, or my goodness, if it's political climate, the social injustice,
Right.
and social equity issues, we should be talking about mental health.
Right.
It permeates everything. And so we need to make sure that we're thinking about that and thinking about our own mental health as well as our neighbors' mental health.
Right. Yep. Yeah, and hopefully move toward parity because, we know that a lot of people who need mental health can't get access because of their insurance benefits, or they don't have insurance, or they have a different type of insurance. And so I think that's hopefully will be a discussion that occurs at a national level, that we start to give more people access to mental health services. Because once again, there's a disparity between the haves and the have-nots when it comes to access to healthcare.
Absolutely.
Mental health care.
All right, there is a link to the article in the show notes, so you can check it out and read a little bit more about what Dr. Carlson has to say. It's a great article. So, all right, that is it then for today. Until next time, stay happy, stay healthy, and forget to be afraid.